One here on behalf of Roida, Sharman, Renee King. We want to welcome everyone to this other edition of the KM COP quarterly meeting, where we will be listening to three vibrant presenters from about KM experiences at the country level. So we will have these three presenters. The first will present for about 5 minutes, and the next two will present for 15 minutes each. And at the end of the third presentation, we'll have ample time for question and answers. So while you are listening to the presenters' presentations, we need that you jot your question down, and during the question and answer session, you will be provided opportunities to ask your questions. And please, you are encouraged to direct your questions to the various presenters so that they can amply respond. All right, that said, Tara, if you are ready, we would like to hand over the mic to you to tell us about the next steps in defining PCPs, KM, and mission statement, and also strategies. If you are ready, Tara, over.
I am ready, thank you. So we wanted to loop back to this group, and first of all, I'll say a big thank you to the Knowledge Management COP for continuing to work on and think about collectively how we can define our vision and mission, and we've also even stepped into the strategy. So if you want to go to the next slide, I'll just give a quick reminder of where we had left off. So our overarching vision is all health and development practitioners are equitably access, capture, exchange, and use knowledge, and continuously learn and collaborate to inform decision-making and create, adapt, and strengthen programs, policies, and services. So this is something that we collectively came together and worked on and improved. And then we have also developed our mission, which is our mission is to ensure knowledge is valued and equitably accessed, shared, exchanged, and used among health and development professionals. And then we further outlined 4 different bullet points here. So one is partnering with domestic, national, and regional entities. And I believe we had a conversation when we met together at the worldwide meeting that when we're talking about domestic, we're thinking about our US domestic work. And then also we want to be leading KM innovation and research. We want to be educating, inspiring, and engaging health and development practitioners with traditional and new approaches, and then co-designing context-specific KM interventions that are authentic to the culture and the setting in which we are working. So if you can go to the next slide, please. So as part of the worldwide meeting, a number of us gathered together at that meeting. Good morning, good afternoon, Gloria. As part of that meeting, we had broken into 4 different groups related to the 4 different pieces of the mission that I just mentioned. So our first group was looking at strategy number 1. So this was partnering with domestic, national, and regional entities. And as part of that conversation, we talked about, well, how would we move this forward? What do we need to be thinking about? So the 3 major buckets of conversation centered around thinking about some guidelines for partnerships. So thinking about ways in which we might align our values and priorities when we're identifying partners. And then there was some conversation around thinking about knowledge management for capacity, but thinking about how we want to clarify those goals and framing. We also talked about entities for partnership. And so we thought about who might we want to partner with and how would that add value. So we looked at research entities. We often know that there's a lot of data that might be available, but it's not being put into use. So there could be a role for us there. We could think about in countries where there's strong corporate social responsibility and private sector partners that we could identify some shared values and partner with them. We could look at government parastatals that would have big KM needs. And then we talked about private foundations in our countries of implementation. We also looked at what types of partnerships we might engage in. So we talked about publication, and then thinking about ways in which we might write and design with learning and publication from the start. And then thinking about where we might pursue more KM roles on global USAID projects where we can set up strong learning networks in between countries. Next slide, please. So our second strategy centers on leading KM innovation and research. And so here we talked about ways in which we could really be leading the charge in terms of developing a learning agenda and indicators. We've already been leading in this area for some time, developing our KM indicators library. So we could also convene and do a consultation where we're defining an overarching KM learning agenda. And then we could advocate to get the KM indicators that we already have into better use. We also talked about some assessment and research. So as part of the Knowledge Success Project, we have had a competition called the Pitch. And so we could do research on the pitch winners to showcase KM evidence there. And we could also look at ways in which we might identify partners where we might do KM assessments so we could serve as consultants in that role. We also talked about it from an advocacy and communication perspective. So, you know, we have been leading in this area. How can we increase awareness of some of our newer KM interventions, thinking about how we can include ways to make our KM research more visible. We've done a lot of research on this and ways we can put it on our CCP website and find other ways to you know, just showcase what we've been doing in this arena. And then we can also think about ways in which their SBC and KM can work together. Next slide, please. All right, so strategy number 3, this is where we're educating, inspiring, engaging health and development practitioners with traditional and new approaches. So here we were thinking about ways in which we could create some advocates for KM. We have been experimenting with and had success with using knowledge management ambassadors as part of the Knowledge Success Project. So that's something that we could also consider doing with other funding mechanisms. We thought about doing training, creating demand for the KM training package that's already in existence. We can build cohorts of trained KM experts through country and regional trainings. We can think about having online courses be part of job requirements, and then also do some knowledge management skill shots. Another area was just thinking about ways in which we could put knowledge management into work plans, and then also framing knowledge management as a service that we can provide to others. All right, and then we can go to the last strategy. So our last strategy is co-designing context-specific KM interventions. And again, we want these to be authentic to culture and setting. So we thought about ways in which we can consider co-designing and really be considering whose voices are included in the room, think about what co-design might mean in different contexts, and then make approaches context-specific through co-design. We also thought again about building demand for knowledge management. So co-design to develop terms to better understand knowledge management, and then do some training to help build demand. And then some other topics that we talked about here was doing a better job of documenting our processes and outcomes, and then leveraging storytelling a bit more. So I know I only have 5 minutes, hopefully I've kept to time, but just to say briefly again, and to thank you all for all your contributions to the vision, the mission, and the strategies. It's been really wonderful working with this group, and we're really grateful for your contributions. From here, we want to move these discussions to the KM unit, which is where we have staff on projects where we're either the prime or we're a sub, and there's a significant knowledge management portfolio. And we want to think about ways in which we can move this forward so that it doesn't add additional work to anyone's plate. So some ways in which we can do that is we can think about making this part and parcel as the knowledge management projects we currently have. We can think about ways in which we can align this work with our CCP strategic plan. And then I will say that we already are starting to have some of these conversations as part of the brainstorming for the Global Knowledge Management Award that some of you have also participated in. So those are the plans from here, and I will turn it back to our facilitators. Thank you for the opportunity to give you an update.
very much for walking us through the mission, vision, and the four very innovative strategies. We are so excited to have listened to you. We are moving straight away to meet Valentine from Nigeria, who will also be walking us through a typical day in KM Nigeria's live. Valentine is looking at KM from a programmatic point of view. Valentine, if you are ready, please have the mic.
Okay. All right. Thank you very much, Rennie, and thank everyone who has actually brought up the time to actually join this COP meeting. Next slide, please. So I'm going to be running us through how we sort of do KM in Nigeria, and I know that some of the things I mentioned is not entirely new to some persons. To some other persons might be entirely new as well. So you can, if you have questions, you can actually drop them on the chat box, and or when it's time for question, I will actually be available to address it as well. Next slide, please. Okay, and next slide. My name is Edozin Valentine, and I support the knowledge management and documentation unit in the Brick Traction Nigeria project. Next slide, please. Hey. Okay, all right. So just to spend a couple of seconds here, where I just like some of us to know what the portfolio of the Brick Traction Nigeria project is all about. So, this is actually one of, or if not the biggest project under the prime implementation of CCP, and part of what we try to do, our intermediate result basically is to improve individual and social determinants of health, and then we also want to strengthen SBC across USG investment and also the public sector at national and subnational levels. And then we have presence in over 12 states, and we have a staff strength that is over 200. So you can actually have an idea of how big the Brick Traction Nigeria project is. So why I just had to talk about this is just so that you sort of have an idea of what it means to do KM in such a very large project. Next slide. Okay, so our KM objective basically is to improve a system of information flow and to ensure that there is knowledge sharing, across teams. We also want to improve a system of learning for adaptive management. We don't want a case whereby teams will have to, reinvent the wheel, and then lastly, we want our stakeholders to be aware of the work that we're doing and some of, if not all, the results that we're actually gaining from the approaches that we implement across all the states. Next slide, please. Okay, so just before I move forward, this is the team of brilliant KM people I work with. So we're being led by Mekwali, and then we have Ramatu as well. Then myself, Alheri, Chukunedum, and Dr. Kemi. So basically, what we do is we backstop or we provide support, to each thematic area and also approaches in the project. So for Ramatu, she supports the RCC and also all the components of the ISBC. Then I also backstop the malaria, the PBC, CCS, public sector, and also the SBC ACG. And then for Alheri, she also supports the TB team, RML, and operations. And then Chikunedum provides support, KM support to the digital media and also some component of the ISBC team. And then Dr. Kemi manages the Springboard, the Compass, and also everything that has to do with conferences and ARs as well. So when I go into the conversation, you're going to see why we do this backstopping approach and why it is imperative, for teams to, support all these teams. And then also, like I mentioned before, the reason why we have, this large team of KM people, next slide. Okay, so in the project, because of how large the Brick Traction Nigeria project is, like I mentioned, we have over 200 staff. So we just don't do the work alone as the KM core staff. We have KM focal persons. So this is persons who sort of support us to do, KM work in their respective states and also in their respective units as well. So they have some responsibilities such as championing the use of KM platform. They also support us with quality KM output. Then they also identify capacity building opportunities, and they also help us to do some level of internal and also external sharing as well. So these people, their secondary and tertiary responsibility is KM. They have their own primary responsibilities, what they do, but they help us to do some of this KM work. So that's the system we've been able to build to sort of effectively make KM work in Breakthrough Action Nigeria. Next slide. Okay, so some of the tools and approaches that we use to facilitate KM basically. I mean, we do reporting, obviously. We try to support the teams and also run through all the process of developing both quarterly, annually, and annual reports. Then secondly, as KM people, I mean, it's imperative that we lead learning and sharing sessions. For learning, after action reviews, knowledge cafes and exchange, review meetings, pause and reflect. And also for sharing as well, we try to lead brown bag sessions, webinars, learning series as well. So these are like some of the tools, that we use for learning and sharing in BE. And then finally, we do some level of documentation, especially where we do product development for program briefs to fact sheet to manuscript, abstract case studies, etc. And also, we just don't keep those products. We actually disseminate them through our newsletters, through our bulletins, on social medias, on websites, also email blast as well. And then finally, we manage the team drive, right? So we also try to archive all the necessary materials so that the project teams have access to these materials as well. So these are some of the tools and approaches that we use to facilitate KMEB in Nigeria. Next slide. Okay, all right. So some of, like I think I already mentioned this in some of the tools. So some of the examples of the KM activities, I mean, these are like some of the really popular ones, so we do state-to-state learning. So basically, this is like a knowledge exchange approach, that helps us to sort of see how we implement approaches in different states, because over time, we've actually discovered that we have different nuances of how a particular approach works, in different states. So sometimes we do a knowledge exchange where, state officers, sort of share how they implement a particular approach in their state. And then we do after action review. This is more like a very popular approach that we use in Breakthrough Action Nigeria. So we use it for when we're done with so many activities like the World Malaria and TB Days. Also, when we do the National TB Testing Week, we just try to come together and see what went well, what didn't go well, and all of that. But the one that is really interesting, the quarterly pause and reflect we do is, so after our quarterly reporting, we like seeing the state come together, and also the country office thematic teams as well. So we come together. We also try to reflect on the performances of what we've done in the previous quarter. I think for last quarter we're able to discuss through high performing states, low performing states. What were the nuances to maybe say like a high performance? What are the things that maybe a state that is currently going through a low period, could adopt some of those. So this quarterly pause and reflect have actually helped us to see how we're able to adapt learnings from other teams. And then product development and also review meetings. So for review meetings, this is really peculiar at state level. So we use this. So the media team uses it also for community volunteers, SBCCG members, the WDCs and WEGs. So all of these people use the review meetings as well. Next slide. Okay, so a typical day doing KM at BA Nigeria, basically. So first of all, so there are quick email checks and calendars, just to sort of catch up with what you have to do with the day. Then it's also followed by, just having some meetings with some thematic leads or some thematic area teammates, to sort of know, okay, what are some of the KM plans that we have, to see how we're able to apply SBC to their work. And then we also do some level of social media, like a lot of social media as well. So sort of, curate and also post some of these on some of the content that we have on social media. And then we also, like I mentioned before, then we get to, manage the team drive, So like I said, this is just what it's like across the team. This is not just myself. This is sort of, so you see, because of the robust team that we have, so we get to do, sort of a lot, like in a day. So for learning activities, I mean, I think there is no day that probably one member of the team does not maybe support, a learning activity or prepare for a learning activity. And then at sort of like 2 p.m., we just sort of checking with our to-do list to see, okay, and I mean, this is probably what everybody does. I mean, after you've had your lunch, sort of want to, check what you've done for the day. And then we sort of liaise with the Baltimore team. So because our time difference, so around 2 to 3 p.m., is always, a nice time to sort of touch base with the Baltimore comms team if we have some final products or probably some time, some product, we actually send this to them. And then we just do some last minute check on emails just to sort of wrap up the day at 5 p.m. Next slide. Okay, so like I think I already started mentioning some of this. So this is how we've made KM work so well. So we have a robust team at the HQ, the 6 brilliant persons I showed you, at the beginning of the slide, so we have that robust team, and then secondly, like the backstopping approach I already mentioned. So we have a member of the KM team that is assigned to support thematic area, so this sort of helps us know we're like in the know of what these thematic teams are doing, and we're able to provide, that direct KM support. So working with KM for CAP persons already, which I already mentioned. So like I said, there's a rep from each state and unit that helps us to do KM related activities. These people are not KM staff. They just help us to do KM related activities. And then we have, that support from the senior management level, which is led by Ian Tweedy. So the team leads have been able to see, so the more they give us the support, the more they've sort of created that relevance for KM in BA Nigeria. And then we've been able to, integrate relevant KM tools, AR review meetings. These are like really popular KM tools across BA Nigeria that, most of these, if not all the thematic teams are always aware of. And then we've been able to articulate a KM strategy. In fact, the KM for CAP persons have sort of like a KM pet project, that they have to do across the year. And then we have our own, KM annual strategy that we have. So and then we've been able to ensure that the teams recognize KM as an ongoing process, and then we've continued to demonstrate KM. And we have that relationship with the Baltimore comms team, that they continue to help us to review some of our materials, get us some of our materials to the finish line, and also help us to publish our final products. Next slide. Okay, so since I've mentioned some of the things, that have made KM work, I mean, obviously, so we have, some challenges here and there that, we'll continue to make sure that, we get better. So for a while, it seemed as if the role of KM was sort of unclear, so before it's more as if we're just there to take photos, write success stories, and do reports and do some level of PR. But I mean, KM is really, really, really more than that, so that we experience. And also we're trying to harness that culture of, using the team drive as well. And then as well, there's also this sort of unseen value, ahead of KM, so maybe sometime when we go for some workshops, it's like, okay, KM, we want you to do a presentation on reporting, and then maybe I have only like 10 minutes to do that presentation, and I'm like, how I can't actually do this level of presentation with this time. So it's almost like as if it's sort of an afterthought. And then finally, we're still trying to build this level of inclusiveness in the sense that when teams want to start planning an activity, like we sort of start with KM from the start, not from the middle or at the end, from the start. You start with KM for when you want to begin an activity or an approach or whatever it is. So these are like some of the challenges, but actually we're trying to pull through these challenges as well, and we'll continue to do that. Next slide. So yeah, for the opportunities, the team have identified that KM is a strategic asset, so the teams are beginning to be very intentional, and then they've seen KM tools as a solving problem approach. So when teams want to sort of refine how it is they're implementing an approach, they do KM, right? Whether intentionally or not, they want to do a review meeting or they want to do an AR, they want to see what they've done and how they're able to refine their approach. Then secondly, there's a need, we've sort of noticed that there's a need for a knowledge base or continuous use of the knowledge base. And then yes, there is continuous learning and adaptive management. Teams want to learn from what other teams are doing, and then there's also that growing culture, for teams to want to document their activities, and then we want to continue building or build a system of KM enthusiasts. Like I said, there are KM focal persons. In fact, some states have like 2 KM focal persons, people who want to help to do KM work. So, we're like trying to strengthen and trying to build that system. Even some of the team leads, are really interested in KM. So, and then finally, we thanks to the donor, sometimes we get requests from USAID for products or PMI, but most interestingly, like for this year, we had to do a pause and reflect session before we did the main FY24 work plan development. So for them to be interested in allowing us to do a pause and reflect even before the work plan, so that culture of care from the donor, also provided these opportunities, for us to implement care. Next slide. Okay, and we have so many achievements. In fact, we just had to just mention this one for this. This is just probably just for FY23. So, like I said, learning and sharing is like our core. So we've seen that culture is being built. If you even look at this meeting, we have so many BA Nigeria persons on this call. So there's that culture of just wanting, to learn, and that culture of wanting to share is there. And then for our publications, we have so many articles, implementation stories, and case studies that we've published on the CCP side and the BABR website as well, and also so many videos and documentaries that we've actually published on the YouTube page. And then for reporting as well, we've been able to improve the understanding of so what and lessons learned. In fact, so what is like sort of like a slang, around the office, like when you say something, people are like, okay, what's the so what? So when people even get to write now, at the back of, because we've been able to sort of instill that culture of just don't write, but when you're writing, why are you writing this? So we're sort of able to inculcate that culture, in and around the office, and then finally, for use of social media, we've been able to reach over 90 million persons, with messages on RMNCH, TB, malaria, COVID, etc. And most recently, BA Nigeria was one of the winners of the 2023 USAID Climate Photo Contest. And we also had a photo feature on the 17th PMI annual report and other global publications as well. So these are like just some of the achievements that we're able to mention at this time. Next slide. And yes, I'm going to finish my presentation with knowledge management is everyone's business. It's not just for the core staff, it's not just for the KM focal person. Knowledge management, for it to be effective, it is for everybody to participate, and also want to learn and share as well. So thank you very much.
Thank you very much, Valentine, for walking us through such a robust KM system and a lot of activities happening there, KM activities happening there in BN Nigeria with a very bulky team. I like the way you ended. Knowledge management is everyone's business. Thank you again. James, James who will be talking to us on a typical day in KM, a typical day of KM in Kenya. James will be looking at KM with an MIEI. James, if you are ready, please, you have the mic.
Yeah, thank you, Rene. I hope everyone can hear me or you can get me. Great. Yeah, so I'm going to share with you experiences from Kenya, and ideally this will be from the eye of an M&D point of view, being that in Kenya we don't have a specific, well-defined knowledge management unit like Nigeria, and also our coverage in regards to the implementation of the USAID-funded activities are spread within a certain region within the country. So I'm the M&D advisor for the project, and therefore I'll take us through this. Next slide, kindly. Yeah, so in Kenya, we are implementing 3 technical areas of support to the national level, as well as to the county and the sub-district level. And our coverage is in the lake endemic counties, which are 8 counties that have the highest malaria incidence. And also within these 8 endemic counties, we are implementing adolescent, youth, and sexual reproductive health, but these are just confined to 2 counties where, again, the teenage pregnancy incidences are quite high. And most recently, we also got funding for support of menstrual health and hygiene, targeting workplace employees. And we are doing this across 3 companies or workplaces. Again, just leveraging on where our malaria and reproductive health adolescent activities are, we are implementing in 2 counties. So we use the technical approaches of human-centered design, and ideally this is the backbone of how the breakthrough action projects, I understand, run across the other different countries. And just this is to help us understand what are some of these gaps or barriers that are affecting individuals to uptake different health interventions. And then we also implement through the community engagement for both the malaria, AYSRH, as well as the menstrual health. We really have a strong strengthening capacity around community where they're able to tackle the health issues by themselves. And this is one approach of ensuring sustainability based on how the teams are able to organize, set their own priorities, do their action plans, and then act in terms of engaging to the barriers and identifying solutions to those health issues. And then, of course, we have the social behavior change communication, just reinforcing the uptake of different service behaviors among communities. Yeah, so the next slide. So based on this, we try to bring out the evidence. We try to use that data. And we have fabricated knowledge management in terms of the M&D support to the team. As I said earlier, for Kenya program, we do not have standalone knowledge management unit, but we utilize the capacity of the M&D teams to be able first to engage and reflect on the activities that have been supported out there, be able to explore, are the teams able to reach some of the targets that we've set in our annual work plans? Have the teams been able to identify the gaps that the county and the national have requested our support in? And also the beneficiaries, based on the action plans, have they been able to meet and track the implementation of the activities? So from this, we can be able to document what are some of the experiences through the success stories, and also as a requirement for donor, we also bring out what are some of the key lessons learned as we implemented our activities during those specific periods. We again also try to explore our different capacities so that we can draw skills and also knowledge from each other. Again, this is based on the in-house monthly review meetings, in-house monthly knowledge cafes that we run. And of course, these are helping us to, draw some innovative approaches on how we can engage in the different setups or the counties where we're implementing. And then we also foster prioritization, adapting and application of those successful approaches. And I'll be sharing with us some of the, key lessons that we've picked. Next. Yeah, so basically from the angle of how we support the teams, and I've used the headline use of knowledge management in our M&D role. Just to mention that in Kenya, we have 3 M&D staff. I take the lead, and then we have 2 M&D officers who support both the project staff and the Ministry of Health. And one thing that we want to strengthen around the SBC is the issue of documentation, because we know at the health facility, once beneficiaries or the clients come in, there is documentation of services provided, because we are looking at antenatal care, adolescent care, and even the menstrual health support in these workplaces. So if there is an established, strengthened documentation, then of course it will be able to, at the end of it, ultimately reflect improvement or the service provision that the individuals have been able to access. And ideally, from our angle, as we move on, we have been able to ask ourselves, are there those outcome indicators that we can track, and thus create that demand for use of this data by both the Ministry of Health and the project staff. And then we've also fostered the activeness in terms of participation by the project staff, so that they ensure that it is not only an M&D demand for maybe what are some of these key lessons, how do we implement these processes, how are we able to identify the barriers, can the data really strengthen how they leverage their technical capacity in regards to the data use. So we target the individual staff with their different skill sets. There are those who are good facilitators. So when you have a session like of a training, are they involved to strengthen the capacity of the other team members to really, share out and do facilitation well? In terms of mentorship, if it is that Ministry of Health identified index healthcare provider, can they be able to be mentored to support the rest? And here I'm looking at, for example, at the community level where we do the interventions, can we be able to have one person who can be able to really replicate some of the key lessons that we've picked and the best practices across different areas? And lastly, of course, capturing the project needs. We have demand from the donor about issues of documenting the success stories. We as a project as well would want to showcase what are the key things that we've been able to do that are successful, and also identifying what are some of the appropriate programmatic responses. We have challenges when we implement activities, so we'll need to use knowledge management capacity or the skills to be able to drive the need to the technical officers in terms of the programmatic responses. And so some of the tools that we use or the techniques that we have employed to really strengthen our capacity wholesomely across the both technical and the M&D is the institutionalization of knowledge cafes. So we have purposed this as a way to really build our capacity basing on the different skill sets. And therefore, during our monthly data review meetings in-house, that is for the project, we're able to identify what are some of these gaps that have been noted across the different counties. And if there's a best experience or implementation strategy that is working, and those individuals who have employed these opportunities, then we have the knowledge cafes to be able to, identify some of the needs and build a discussion with the team members on how best to really have this cross-cut across the counties. And then we also have the after action reviews. And this, I'll look at it from 2 angles. Internally, we have the project level monthly review meetings, which again, we reflect on the performances based on the targets that we've set. And then secondly, we have the county and the sub-district level review meetings. So we have identified Ministry of Health staff who are our mentors. And so wherever they go out or wherever they have identified some gaps in terms of data or implementation, they call for support on data reviews or, what we call community action group review meetings. So with this, they can be able to reflect what are some of the emerging issues, what are some of the new things that they need to employ or, develop so that they strengthen. And then also during the support, supervision, and data review meetings conducted at facility and community level, some of the good things that come out and even the barriers that have been able to be identified, again, the mentors are able to congregate and go through it and identify some of the solutions. In terms of our presentations, of course, we use the data visualization and infographics. This again cuts across in-house and even externally, because we are able to use the projection of the charts, the representation of the graphs to tell individuals or even the participants that this is the progress in how the different segmentation of our target groups is. And then for our peer assists, we have 2 layers as well. So internally, we have coordinated among ourselves as the M&D team to be having bi-weekly meetings. And from this, we reflect on the support we've provided to the project teams in the field activities. And if there are new things that are emerging, or if there are things that we feel need to be changed or reciprocated, then we can be able to do that as an M&D team in terms of support. And then also, following our monthly data review meetings, I'm able to identify key experiences that the project social behavior change officers speak about. And we hold on a Wednesday, it's for malaria. On Thursdays, it's for the AYSRH team. So this is different from how Nigeria has presented their daily. But for us, it's more of like weekly, based on what are some of the feedback that we receive during our review meetings. And then, of course, documentation of some of the success stories. So when you listen in as they speak about some of the things that are working well from the field experiences, then we are able to tie some of those ideas to developing our success stories. Next, please. Yeah, so these are some of the pictorial capture of activities that have taken place. On my far left top is a discussion by the sub-county team after support supervision. So they pick out what are some of the key things that they documented. And of course, in the middle, we have a review meeting with some of our youth champions. And then we have a facilitator that is a sub-county person conducting a feedback meeting with the CHVs. Ideally, those are CHVs seated around. At the bottom left is after our data review meetings, the sub-counties congregate to draw action plans based on what are some of the emerging issues. And then in the middle are after a training of the community action groups, they are able to draw their action plans. And then this is a performance review meeting. On the far right is a performance review meeting, internal performance review meeting with the project staff. Next. Yeah, so some of the challenges that we've been able to, go through, there's a lack of that knowledge management, technical skills, or understanding of some of the ways in which the technical staff, ideally within the project, can be able to, shout out knowledge management or support each other across that. And then the issue of competing tasks, as I mentioned, we are only 3 M&D officers, so we have to balance on how best do we support malaria, reproductive health, as well as the menstrual health across the 8 counties. So it's a tough call for the 3 of us to really scale up knowledge management, regularly or routinely. But we have opportunities. So with the institutionalization of the monthly knowledge cafes, we have seen improved changes, especially on the strategic implementation of activities, because there's knowledge sharing among the staff, and there's also experience tracking among the sub-counties or the sub-district that we are working with the mentors. So they are able to pick that and, replicate in terms of activities. And then, of course, the availability of e-learning platform, especially to speak about the SBC online courses. We've seen a number of our Kenyan team take these courses, and they've been able to draw their knowledge about the different, health areas that they can support. And then there's a demand for project visibility. Just to mention that in the 8 counties, we are implementing in 32 sub-districts across a total of 63. So wherever we have our activities, there's been a call for us to expand. And with this, we've been able to use the opportunity maybe to share with the teams how are our approaches working out. And we have seen in the sub-counties or the sub-district we are not implementing, there are some approaches in terms of community engagement that where we are not having our strong foot in those sub-districts, people have been able to replicate or borrow the ideas for that support. And of course, this again has really leveraged in terms of how we scale up some of these interventions. Yeah, so I'll just like to share something with the team so that we can be able to see how, from the M&D angle, how best have we been able to pick knowledge sharing, pick the skills, and even some of the ideas that have come from the field for us to be able to, scale up the interventions per se for, okay, just a second. Kindly confirm you're able to see Malaria Dialogues dashboard, right?
Yes, James, we can see.
Okay, great. So as I mentioned about the peer assist as a knowledge management technique that we are using, one of our M&D officers is a tech savvy in terms of development of databases, especially using Power BI as a visualization tool. And so following our routine data reviews and discussions internally, we identify that we cannot be able to really picture out facilities or specific communities down there that have challenges in terms of, meeting their targets or even implementation of their action plans. So this is just a shell. We've not drawn out the data, but it's been able to help us to really picture out overall, if you are able to look at the overall performance of the project, it can draw to you down here. I know it's just the end of the month, so this data is still being pulled up, and that's why it's still blank. But it's able to tell you contributions by individual sub-counties, and you can even go down to individual facility level. And with that, you will be able to identify the mentor or the attached sub-county contact person to point out on the facilities that are still having challenges in meeting some of their targets. Secondly, using this knowledge that this individual has a good skill set in terms of developing the databases, the peer assist has modeled us as an M&D team to really leverage on each other's capacity. And thus, with this tool, you can be able to see there are several other, on this far left, there are several other dashboards that we can again leverage in terms of ensuring that the project teams are well informed on which target areas and support to do. So you have both the project level focus on malaria dialogue, so the social behavior change officers supporting malaria are able to come into this dashboard, are able to narrow down on where the gaps are, which intervention population, like if it's general population, the men only, and the pregnant women, they can now narrow down on that. When it comes to support supervision, so that I increase this, we can be able as well to advise the technical team based on some of the challenges that are priorities. And again, with this, they can be able to draw out what are these barriers that have been identified during the household community health provider visits. Are there things that are coming out that we can focus on as an SBC team to really strengthen? And therefore, you will see that there are issues on discussions on the barrier on net use. There's the issue of ANC mothers' continuity on ANC clinic visit, the issues of follow-up on antimalarial adherence, drug use. And so as a team, we will look at it from the SBC angle and work on what is working. And if there are needs for us to work with the other partners, we will also share with them in regards to what they need to do. And so these are some of the lessons that we've leveraged on as our M&D team in regards to support of knowledge management. And I think really that was the very last presentation from my end. And thank you so much for listening in.
Thank you very much, James, for bringing out the complementarity between PM and MRE. We have, like I'm sure other participants too have noticed the difference between both the Nigerian team and the Kenyan team. The bulky Nigerian team and the much smaller Nigerian Kenyan team. So we have about 7 minutes to the end of the hour. Unfortunately, we will not have time for a lot of questions at this time. I will encourage those who have questions to put the questions on the chat box, but we'll be able to take a few questions just for the presenters to address it rapidly because time is against us. But we are ready to pick up all the questions from the chat and provide responses with the contribution of the presenters, provide responses and share with the entire team as we are sharing the recordings. So it's time. I see a hand up. Manuela, you have your hand up. While Manuela is asking her question, please kindly put up your question on the chat box so that we can capture the room there. Thank you. Manuela, you have the floor.
Thank you, Renee, for giving me the floor. Nice presentations to all the presenters. It was a very great learning session where I may just like to know, asking to Valentine's, is it, are they the stakeholders that express a need of learning from what you are doing to reach those results? And also, is it, I saw the typical day, and is it from the meeting that you have with the programmatic that you gain all the information that allows you to reach the results that have been presented, or mostly do you involve yourself in the building of an activity or project before it is implemented? Or is it a challenge because you said that it seems like sometimes they forgot KM? And when I look at the realization of Nigeria, and I see that the team is very huge and there is a big portfolio, but I am curious of knowing if there is a specific budget which is allowed to KM activities, or how is it organized? Is it something that during the programmatic activities, if something has been set up ahead, then you carry it, you implement the things together? So this is what I wanted to ask, and congratulations really for all those presenters. Thank you. Over, Renee.
Thank you, Manuela. Valentine, please, you can provide some elements of response to Manuela. Unfortunately, we don't have time.
Okay. Okay, all right, thank you very much. So I'll just address that quickly. So yeah, so some of the KM activities are in the work plan. There are some activities that are KM-led that are actually in the work plan. And then there are some that just arise, or we sort of integrate into another activity. You know, we're just able to, okay, let's just integrate a KM learning approach into, or a KM learning session into that particular activity. So it's not like we just have like a clear-cut, budget for KM. No, we sort of integrate into other thematic area activities. Then secondly, you asked about how we're able to, know what the team wants. So like I mentioned, so we have two systematic approach. They are sort of novel to how we've been able to implement KMP in Nigeria. So one is the backstopping approach, where we have, so like you mentioned, we have a robust KM team, and then each of these persons, are domiciled in a particular thematic area. We have somebody who supports the TB unit, then malaria, RCC, and all of that. So, and then we sort of, attend all the check-ins that they do. We're like part and parcel of what they do. So with that, you're able to, have like a first-hand insight of what the team is doing. And then if there is a need, for a KM activity, or for them to apply a KM tool, you're there and you know that firsthand as well. I'm trying to remember your first question, Manuela. I didn't quite. get that, but I think I've been able to address your last two.
It was about the stakeholders. Those are the partners, your government side.
Oh,
You
okay,
raised,
yeah.
some of the needs, so yeah.
Okay, great. Yeah, so I think one way we've been able to do that as well is like I said, so I mentioned that we have so the care and focal persons across the state, help us to do some of the care related activities, and they also sort of liaise with those partners and stakeholders. So if there are learning opportunities, we're able to support them to do some of those work. Then at the country office level as well, like I did mention, we have the support of the senior management and also the team leads, and some of these people or all of these people liaise with partners and also government stakeholders. So if there is a need, for us to apply a KM to, they actually bring that back to us and we sort of support. So like most recently we did a KM and social media training for the National Malaria Elimination Program, so that feedback comes from, the interaction with the team leads with those government people, and then we're able to sort of address those KM needs. Thank you.
Very much, Valentine, for the response, for the element of response. One short question for James before we close. In your opinion, James, do people generally understand the word knowledge management, or are there any other technologies that you use to drive across the notion of knowledge management?
Thank you, Rene. Yeah, I think based on how it's always been laid out, that knowledge management is a standalone kind of, implementation or activity. But in Kenya, we've tried to demystify that, especially from the project implementation level, by having the team understand that whatever the interactions they have with different players, be it stakeholders, be it partners ourselves, or even the beneficiaries, there's knowledge management through what are the documentation of key lessons learned, what are the documentation of prioritization of activities or areas where they can really strengthen each other's capacity. And this again is to speak in terms of how best can they be able to share out some of the approaches in terms of implementation or even learnings that they've been able to do in their respective technical areas. Yeah.
Great. Thank you very much, James, for the response. In the interest of time, we will end the meeting at this point. We are at the top of the hour. I want to particularly thank Kara, Valentine, James, and all of you for your participation, brilliant participation. We look forward to having another Teams of Practice meeting early next year, January or February. We'll keep you updated. In the meantime, we will share the responses and presentation as well as the recordings from this meeting in our Community of Practice page on the Hive. And we are also taking questions that are coming into the chat box for us to provide responses as we are sharing the resources. Thank you and have a blessed day for those who are beginning their day, and a great evening for those of us who are almost ending our day. Over. Bye for now.
Thank you, everyone.
Bye.
Bye.
Bye, everyone.